अब बात होती है हेल्दी ईटिंग, हेल्दी लाइफस्टाइल की।
जी, हेल्दी लाइफस्टाइल की बात होती है तो फिर आप क्या न्यूट्रिशियस डाइट कैसी ले रहे हैं आप और कितनी बैलेंस डाइट ले रहे हैं आपके रूटीन में, क्या खा रहे हैं आप, क्योंकि जो आप खाते हैं बॉडी आपकी रिस्पॉन्ड करती है और उसी हिसाब से फिर आपको फेस भी करना पड़ता है उसके कॉन्सिक्वेंसेस जब हेल्थ खराब होती है आपकी।
बिल्कुल ऐसे
तो ये बहुत ज़रूरी है।
इस पर्टिनेंट सब्जेक्ट पे हमारे पास आज खास मेहमान मौजूद है। दीबा यानुली, रीजनल हेड ऑफ कॉर्पोरेट अफेयर्स साउथ एशिया एंड सब Saharan Africa. Welcome.
Welcome to the show.
Assalamu alaikum. Deeba. Deeba, so jumping right into it, there's an amazing campaign that you're running in Pakistan. It's about healthy lifestyle, healthy nutrition. Can you talk about that?
Yes, so we are running the Right to Protein campaign. It's an initiative by the U.S. Soybean Export Council.
Right.
We are operating not just in Pakistan, but along in 5 other countries, so mainly in South Asia and in Nigeria.
Right.
And this campaign it's more than a campaign. It's actually a call to action, a call to actually become more aware of your protein intake, to realize and just start adding protein in your diets, whether you're a mother, a child, an athlete, a bodybuilder, for everybody. So making sure that it becomes habitual in our day-to-day intakes.
You're holding a really interesting paper. Could you show that?
Paper, yeah.
Yes, so a few years ago, 2 years ago, in 2023, we did a study.
You could show it to the camera.
It's called the Pakistan Protein
Perception Study. Yeah.
And it was a survey conducted about what Pakistani people thought about what is protein.
Right.
And some of the misconceptions about it. And so we realized that, yes, although in this country there is a lot of meat intake, people don't understand the value of what protein essentially is. So there are trends that protein is not added in every single meal.
Right.
And so those are some of the trends that we have noticed here in Pakistan. And also some of the children and women don't realize how much protein is required for the body as well.
Can you enlighten us?
Yeah, so protein is one of the 3 macronutrients,
Right.
as you're aware, so along with fats and carbohydrates. And it's an essential building block of life, protein, like your amino acids that you probably see in the health and fitness world talking about.
Yes.
And so per the recommendation, it's 1 gram of protein per kg of your body weight.
Oh, wow.
Obviously, if you're more in the athletic space and you're a bodybuilder or you're at the gym more, you need to increase that protein uptake.
Right.
So on the Right to Protein website, there is a protein calculator which you can go in, you select your gender, your kind of what you're eating. Are you more meat-based eating or plant-based eating?
Interesting.
And you can calculate your weight based on that. And so it's like your weight with your height, like your BMI, but your protein daily intake.
Right.
So, Deeba, tell us something about your response you're getting from public, and for the success of your campaign, you need to have support from the government side
Local
as well.
government.
Yeah, so in Pakistan, we have the support of the Pakistan Poultry Association, PPA.
Right. Yes.
And so, chicken is an affordable protein, right?
Yes.
As along with eggs. So we encourage people, it's like the low-hanging fruit, to add your chicken and add your egg daily. So we do partner up. So PPA in Pakistan is definitely.
But in Pakistan, people are deprived of like basic
Yes.
food.
So
what to talk about protein? So it's difficult task that you are.
And what about how can you replace that? A lot of people can't afford chicken.
Exactly. Eggs.
Or eggs. So how does one replace it with vegetables or certain fruits, greens?
Yeah. So in Pakistan, you have a lot of beans, lentils,
Yes.
legumes, chickpeas. So these are also a high-quality source of protein. You have a lot of nuts as well,
Yes.
right? So a handful of nuts. Protein, pretty much, it keeps you full. When you consume protein, you feel full longer. And so when you're a family or kids or just for the average person who cannot afford it, if you are consuming a bowl of lentils, for example, in the morning, or a bowl of porridge, right, you feel full longer. Your child's not constantly asking you, I'm hungry, I'm hungry, I'm hungry. So there are alternative and more affordable than your chicken if that is a problem.
And if there is a deficiency of protein, what how can it affect supplements and how it can affect your body and your health?
I would say some of the first signs of protein deficiency we notice first are you're tired and fatigue, your hair, your skin, your loss of muscles in your body as well. So these are some of the signs. Supplementing is food. You need protein, just like you need carbs, just like you need good fats. So we're not saying there's like a supplement, a pill that you should be consuming to fulfill that protein intake. It is essential to consume good and high quality protein sources.
And Deeba, what about age factor? I mean, young
After
children,
40, yeah.
adults after 40, you know, parents who are grandparents and, you know, stuff like that. So does that, the protein level and intake should vary?
Yeah, so as I mentioned, that proteinometer, it depends on your
Right.
weight and your height, right? So that is very essential to kind of weigh that child, weigh the mother, lactating mothers, athletes, everybody. So it's not just a one amount for everybody.
everybody.
It just depends on your body
It varies
weight.
from the body to
exactly.
body and body weight.
So are you visiting rural areas of Pakistan, because there is a lot of awareness when it comes to
Lack of awareness over there.
Developed cities like Karachi and Lahore, but when we go towards rural areas of interior Sindh and all that, people are not aware about it.
So hopefully now with a lot of the local industry, we do get a lot of that support, because I think the local industry is also your protein solvers, right?
Yes.
They're putting protein on the plates. So hopefully within some of these associations, they also help in outreach and actually spread the importance of having chicken or egg, an affordable source of protein.
Right.
So,
right, that helps. Deeba, what about women who are expecting, or, you know, just generally also mothers,
yes.
you know, single women who are not married? Are you targeting them? Are there conferences or awareness campaigns that are going towards that segment of the society?
So this campaign it's
For everyone.
for everybody, and it's also protein agnostic, which is such a great initiative to do.
Yes.
That fish, your chicken, your beef, your lamb, your mutton, your lentils for plant-based eating, people who don't consume meat. So it's for everybody, and this is the beauty of the Right to Protein initiative.
So here in Pakistan, availability is the biggest issue.
Is an issue. Also, because Pakistan is rich in these things that you just mentioned, isn't it strange that we're still low on protein?
Yes.
And how does that sort of make sense?
I don't know. Maybe we need to increase the consumption. So this is where the Right to Protein comes. We're open to working with nutritionists and educating
Consumption is related to
nutritionists.
buying power,
The
because people don't
perception, yes. So you know, as our pockets increase, right? As you have higher income, you can afford certain types of protein.
Right.
But for those average ones, you can look at alternative based, not like
Not very
not
high-end.
expensive chickens and cold cut meats. It's all about the awareness. What is protein? What are the different sources of protein?
Also, Deeba, we have a culture of cooking a lot. So like our dish takes like about an hour of just cooking, and how
All nutrition goes down, yes.
you know, how bad is that? Because in the end, you know, you're just eating lots of oil and lots of masala and lots of chilies. How does that affect? Should we just sort of simmer and cook it, take it out quickly, the vegetables especially?
So I think we've learned a lot, right, in terms of COVID, the pandemic
Yes.
period. We became more cautious, more aware about what we're cooking.
Yes.
So I think we're now in the year where we're sort of forgetting what happened. You know,
Yes.
forgetting what we lived through.
Yes.
And so I think when it comes to cooking, we got to be creative, especially the millennials, our generations
Yes.
and newer generations. We want things fast.
Yes.
We want
Healthier.
quick protein-filled snacks. When it comes to cooking, I don't know. I'm a mom of two, and I cook a lot. I use a pressure cooker, like an Instapot. And I
Yes.
think with 1 tablespoon of oil, my
That's the
meat,
best.
I think it's great. In
The thing is
45
that
minutes,
it's a
it cooks.
deep-rooted culture norm. That
Come again?
It's a deep-rooted culture norm, the way we cook
The
our
way we
food.
cook.
Yes,
So
but this
it is
is-
difficult
it
to
needs
change.
to
yes.
change.
It needs to change, but it is difficult to change.
Exactly. It's perceptions, and it's also what it takes to make that change. We're the newer generation. Every country goes through these phases, not
Yes.
just Pakistan, right?
Yes.
Even I'm in the United States, it's the same thing.
Right.
You make that change. You make it habitual, but not do what things the previous generations were doing. You look for a more sustainable and healthier and nutrition secure place
Right.
than it was yesterday. So whatever it takes, and I think protein is very essential. It's a building block of life.
That is.
And I think if people start thinking, I need protein. I need it to fuel my body. I need to consume it. I need not just to have it once a day. I need to eat it my breakfast, my lunch, my dinner. In between, I'll have a handful of snacks, whether it's dry lentil chips. There's a lot of creative, new, innovative products.
Right.
And we encourage food brands and FMCG brands to start looking at alternatives to create more options for consumers.
Right.
Biggest concern for parents nowadays is that kids love to have junk food, burgers, pizzas, and all that. So it's a hard task to bring them back towards healthy eating.
But it happens at home, right? You're a parent. So if you're a parent, it starts what you do at home.
Yeah.
If you encourage, eat your meat first, and then if you're hungry, have a bowl of spaghetti, your fiber as well. Have a well-balanced meal. So what I have done, maybe that works in my household, I always give meat and like veggies first. If they're still hungry, and I would tell you, most cases they are not hungry after because they've had meats which has kept them full. They will not request for rice, or they will not request for that extra carbs. Because what happens if you do the carbs or like a muffin with something sugary, you feel tired and then you get hungry again.
Yes.
You get in this cyclical effect. So, and kids especially, they're more active, they're running around. And so when you build it, you need protein. It's essential. You want to gain muscle. It helps with the tissue repair in your body. It helps with your enzymes in your body. So you want to make sure that whatever you do, whatever you treat your body with, that you're doing the same for your children and making a practice.
Thank you so much, Deeba,
Thank you
for
very
enlightening
much. I appreciate
us
it.
with this. And we really hope that, and we wish that this campaign can run through and through Pakistan, and all the women and children. हम सबको ज़रूरत है बेहतर लाइफस्टाइल की, हेल्दी ईटिंग की, और जैसे दीबा ने कहा that जैसे ज़ुहैब ने कहा कि it's very deep rooted culture, but with time we have to change and we have to incorporate healthy living and healthy lifestyle.
और देखिए ये है कि इसमें एग की बात की और चिकन की बात की, लेकिन बीन्स में भी तो अवेयरनेस ज़्यादा ज़रूरी है. अवेयरनेस होगी तो फिर आप जो है उस तरफ भी जा सकते हैं.
Thank you, Deeba.
Thank you very
giving us your
much. I
time.
appreciate it. Thank you.
Thank you.